All right, it's still Thursday's edition of Morning Ride. So last week on the set, we talked a little about universal health coverage, but of course, because we're not medical personnel, we deemed it fit to bring someone here to the studio who will be dissecting some of these issues that we are facing in our society today. With us here, grazing our couch beautifully, we have with us Dr. Idotenyin Enyi, and she's the internal auditor, Medical Women's Association of Nigeria, MWAN Delta State Chapter. Welcome, Dr. Enyi.
Good morning, Dr.
Thank
Enyi.
you. Thank you very much.
Okay, very quickly, that word is it pronounced as M1?
M1, yes.
M1. Okay,
M1.
so I got it correctly.
Yes,
Welcome.
Thank you very
Welcome.
much.
You're looking very beautiful. At some point, you'll tell us what the write-up is about. But very quickly, let's dive in because we have deep issues concerning maternal health, and would want to clarify some of these things. Now, this particular program started last week, Thursday, if I'm correct, yes. And it's not ending yet.
No.
It's not ending yet. It's I think it's almost like a month-long thing.
Yeah.
All right, so very quickly, take us on the concept of universal health coverage. What truly is it about?
Okay, so thank you very much, and good morning once again, everyone. So universal health coverage, I mean, just from the way the words is, we are talking about health that covers everybody and everything about health.
Okay.
So universal health coverage actually started, let's say, way 1948. Because of the issues pertaining to health, you have a lot of people that have a lot of health needs. They can't meet their daily needs as per health. No, they are no access to facilities, and even when they want to get to the health facility, everything are so expensive. So of course the world bodies came together and they were like, let's see how we can set a target so that by this particular year, we'll have been sure that majority of people or everybody will be able to access whatever needs they can without having to spend too much. I know then they said health for all by the year 2000,
Yeah.
and then 2000 came, and where is the health for all? It didn't happen. And so the international communities are still trying to start to put their heads together, so they came up with the Millennium Development Goals. Now we have the Sustainable Development Goals, which we are hoping that by the year 2030 everybody will have been able to achieve universal health coverage. So universal health coverage just talks about the fact that everybody should be able to access quality healthcare, not just healthcare, but the healthcare should be quality, and then they should access it at a cost that at the end of it all, they won't go back and say, oh, I don't have any money to cater for my basic needs.
Okay.
So accessing quality healthcare at a cost that the people won't go back and become poor. So that's just what universal health coverage is all about. And we're hoping that by 2030, we'll be able to achieve that.
Okay.
Yes.
All right.
Okay, so I was going to ask, when you were talking about universal health care, you said it covers everybody, is an all-encompassing phenomenon. But under universal health coverage, we also have a sector or a set of people that should also be given urgent attention.
Exactly.
So I'm talking about the mothers.
Yes.
So can you please explain what maternal health care means?
Okay. All right. So thank you. When we said about universal health coverage, we're talking about the full spectrum, right from promotive to preventive to curative to rehabilitative. So for maternal health, that women are always disproportionately disadvantaged, women and children, vulnerable. So that's why medical women are coming out to speak. For those that may not have the voice to speak out, that please always make sure that women and children are always on the front burner, especially when it comes to health issues. So for universal health coverage and maternal health, we're talking about the fact that a woman should be healthy before pregnancy, during pregnancy, and after pregnancy. She should be well taken care of. Make sure that throughout that her sphere of life, she doesn't die. She lives and she's very strong to take care of her children. We know that there's this one that say women rule the world, but we know that men will not agree anyway.
Yeah.
But then we need the women to be strong, to be able to take care and handle the issues that come up, because the statistics that are coming out are really alarming. For Nigeria, when we talk about maternal mortality, we're talking about the fact that out of every 100,000 women that go to give birth, we are seeing about 1,000 will die, and it's terrible. It's alarming. Why should a woman die during childbirth? I mean, it's quite unheard of.
True.
So we are trying to find ways we can, use universal health coverage that is there as an umbrella to make sure that women access this care, and whatever the issues are, they don't come out. They come out with positive pregnancy outcomes at the end of the year.
All right. Okay. Dr. Enyi, I'm very aware that the WHO is very particular on maternal health and of course child health. So let us in on some of these guidelines, and of course tell us what are the types of maternal health that we have.
Okay, so for maternal health, like we said, like it's a spectrum. So
yes,
we actually start from, we have the age range for which we say women can give birth, even though we hear testimonies of women giving birth at the age. Exactly. So, we usually say age of fertility is actually from 15 to 49 years. So, yes, we're talking about the health of the adolescent girl. The girl should be healthy. She should, first of all, eat well. So WHO is talking about first, even pre-conception, even before you now start saying you want to be a mother to give birth. At that stage, you should be healthy. So what should you do? You should be able to eat well. Make sure that as a girl, you see your monthly periods. Yes. After that, you're supposed to be on some kind of, blood capsules. You're supposed to live well. Stay away from harmful, behaviors. That period, usually, people like to experiment on a lot of things. Please stay away from alcohol, stay away from drugs. And there's even the part for, those preconception that even though we talk about abstinence, and I know that our Nigerian mothers will not really want to hear, but there's a place for contraceptive care for those adolescents that are sexually active, even though we don't preach that.
We live in denial.
So instead of you going to go and experiment and go and start doing unsafe abortions, and you scatter yourself before when you're ready to now start giving birth, there's actually room for conception care for them
that are safe.
Safe conception care. You're supposed to be able to walk into a health facility, discuss with the health care provider what are my needs, what options are available for me in terms of contraception. But of course, we know that cannot happen. So we can imagine the look on the healthcare provider's face looking at you like, excuse me, give me your mother's number or something like that. So just so that our youths are kept strong and healthy before they now start planning, because pregnancy should be planned. Shouldn't be something that, all of a sudden I'm pregnant. Yes. No. So when you are now ready to now start, you're ready to take the journey. You're not supposed to be going for counseling, you take your drugs, and you now plan. When you now get pregnant, that is another issue with our mothers. When they are pregnant, now they will be waiting. Instead of you to go and enroll for antenatal care, because all the health facilities, primary health care centers are well equipped with skilled staff that are ready. They are there to cater for it. But our mothers, and it's usually worse after the first pregnancy. Usually the first pregnancy, I'm pregnant, let me go for antenatal. But once it's the second or third, hey, what are you saying? They are now at home. They don't bother anymore. And most of the time, you see a lot of them coming down with a lot of complications.
Yes.
Their blood pressure skyrocketing because they didn't know. Most of these things don't have signs, so they don't go to the hospital. So the hospitals have been equipped. Thank God, recently Delta State government won a huge amount of money because of what they have done to strengthen and revitalize primary healthcare centers. So we are preaching. Medical women is speaking out to our women, please. Each pregnancy is different. The fact that you've had one or had two, doesn't mean that the third one, even though we are hoping for, everything to go smoothly, but you must register for antenatal. And WHO specifies that every mother should have at least 8 contacts before delivery.
Okay.
So it's not like, let me go once, then I'll wait. Once I feel the movement of baby, I'll go another one. Then once they give me dates, I'll go. No. So there are specific guidelines, and when you go, each visit is supposed to be a contact where you have an experience, where you're supposed to share. The doctor will talk to you and will help you throughout that experience. So by the time you now, so that's the antenatal care. Yes. And then during the course of the labor, we are preaching to our mothers. Please, Delta State has free maternal. Try and give birth in the hospital. Go to our primary healthcare centers. They are well equipped. Go and give birth. Even though we have some skilled birth attendants, but we are advocating that they go to the primary healthcare centers. When you hear them, they prefer to go to somebody else. They'll say,
traditional.
Yes, traditional.
Yes.
And then,
not Eliza.
Thank you. And then the problem with these people is that they don't know when to refer.
Yes.
They feel I can do it. I have
Yes.
experience. My great grandmother used to do it. So when it gets so critical, you see them still trying.
Yes.
So that it gets so bad that by the time they're referring that woman, is just between her, in short, you're praying that the woman will be able to make it out alive. So we are speaking to our mothers. Our healthcare centers have been well equipped. The government is doing so much in that. Once you want to give birth, please do that in a hospital. And then after giving birth, you're supposed to come back 6 weeks. Some women, hey, me and my baby, hallelujah, we don't survive. That is the end. You won't see them again.
For my last child, I'm actually guilty. But I promise to change.
So we have postnatal. You're supposed to come after.
Yes.
We'll see you. We'll ask you how you're doing. We'll advise you further. Hope you're breastfeeding your child, because you're supposed to breastfeed exclusively for 6 months.
Oh yes.
I don't know how many mothers are doing that. No water, nothing. Those 6 months. Then we'll find out how you're doing. How you're taking care of the baby's cord. You know, how is your baby doing? Is the baby achieving the respective milestones? Then we now tell the mother, who advise you on family planning. Even though some say they want to give birth to all that's inside their stomach. It's not advisable. As a woman, you need your body to get back itself, because it's usually not easy. You lose a lot of blood, you know, you need to get back. I know just before now, we were talking about Iron Deficiency Anemia Day that we commemorated some months back. A lot of women, because of lack of iron, you know, they lose a lot of blood during pregnancy. So that's a time for you to get back yourself, you know, stay on family planning, so that you don't tell Oga no. You can still be giving him you know. Then when you're ready, at least after 2 years, you now, you know, say you want to go back again and
okay.
Yes.
Okay.
But,
So, Dr. Enyi, what are the types of maternal health, and what are the risks that are associated with these maternal health?
okay, so like we try to differentiate them. So we have before conception, we have when you're pregnant, and we have during labor, and we now have postnatal. So before conception, you know, we have a lot of women, well, at that time, let's say young girls, let's say, if they don't take care of their health, they can come down with iron deficiency anemia. Some of them can come down with a lot of infections, especially if they went to experiment a lot of unsafe abortions, because abortion is still illegal. You know, Nigeria has not legalized it, so a lot of girls do a lot of things. So a lot of things, you can have infertility from all that. You can have
and
infections.
they go to quacks as
yes,
well.
exactly, and it can even lead to death. So we have a lot of them that, you know, by the time they're even getting pregnant, their body can't even sustain it, and sometimes their babies don't even come out alive. We have preterm labor. We have uterine rupture, a lot of things that can happen during the pregnancy. Then postnatal can now have a lot of women that, what I call it, parapsychosis. You know, some of them start behaving somehow, a lot of that.
Affecting their mental health.
Exactly. Some will, there was a particular experience I remember. The woman saw her baby and was now shouting and like, take him away from me, take him away from me, you know. The woman had to be referred to see a mental specialist, and she was placed on drugs. No, she also started screaming, you know, and all that. So there are a lot of things that could happen, you know, and the worst of it all is that the woman could die, which is what we want to avoid. Yes, we are trying to speak up as medical women that no woman should die.
Okay. You talked about things that affect maternal health, but let us in on some of these factors that are affecting maternal health in Nigeria. And at the moment, where would you say Nigeria is at when it comes to maternal care? We're definitely going to come back to Delta.
Okay. So for Nigeria, I'll say that Nigeria is fine, because first of it all, they have a lot of policies, they have a lot of guidelines, a lot of documents there, you know. But how many of those policies are being implemented? That's actually our problem here in Nigeria. So we have a lot of policies on maternal health, you know, and then we have a lot of support too from donor agencies, because of how alarming our statistics are. So we have a lot of agencies that support with the antenatal medications that they take, all these iron supplements. We have a lot that they are giving to women. And then most of all, they do a lot in terms of training. They train a lot of the doctors, they train the nurses, especially on modern interventions. There's this trial that they call the emotive trial, and there was this particular lady that brought up something like a drip that helps, because usually the main killer is usually loss of blood. And by the time the blood goes beyond a particular level, usually term it postpartum hemorrhage, and that's one of the top killers of women, during pregnancy. So she came up with a drape that helps to calibrate, so that when it gets to that level, you already know that this woman is losing this amount of blood, and you can quickly swing into action. So Nigeria has done a lot into training of healthcare workers, even down to the LGAs, the community people, on how you can recognize danger signs and what you can do, especially within that first few, hours before you feel it's time to refer. So for the emotive, talks about using the drapes, different techniques that you can use to reduce bleeding.
This drape, is it a machine?
No, it's like a cloth.
Okay.
It's like a cloth.
Okay.
Yes.
Okay.
So then we have different methods, teach you how to massage the uterus, and then different drugs. But our problem usually is that some of these drugs are actually fake. How do we know? Because most of the time, you see them, they use the drugs and it doesn't work.
Okay.
So another problem we have in Nigeria is a lot of fake drugs. But we thank God that NAFDAC is trying their own best to make sure that they try to see that some of these drugs are up to standard. So we have a lot of these drugs that are available, and that which we are saying that should be commonly available and affordable, so that when the woman needs to use it, she doesn't have to pay for it, which is why we're saying all this under universal health coverage. And then they need to refer. Once you know that it has passed where you can manage, please refer. And most of the time, the issue is always no blood. And I hear now to buy 1 pint of blood there is I'm sure 2 pints of blood can buy 1 bag of rice. Now we know the cost of rice, so very expensive. So, but most of our hospitals now are equipped with blood bank. We have blood bank, and usually one of the things that happens in some of the hospitals is that when the woman comes to register for antenatal, they already preempt her. Just put the blood. In case you don't use it, we will give you back your body. But just so that we prepare. So we can imagine someone that has not come for antenatal running in at that last minute. Hey, you can imagine the kind of chaos that would happen. So it's always good to go on time. We prepare you just in case, so just keep the blood available. So the government is doing a lot. They've I know that there've been a lot of training, and then centers that have done so much, they have also rewarded them. Like I said recently, Delta State won a prize, and I know that the son of the governor came to FMC some time ago and gave some of the doctors, that were doing so much in this some amount of money. So the government is really trying, but then we on our parts, are we also reciprocating the gesture? These facilities are there. Are we going? Are we utilizing these facilities? Are we going when we need them? So those are some of the issues. But I know that the government is trying, though, in terms of training, making sure that these things are available. But then is it the government that's making the fake drugs? We are the ones now. Yeah. We are the ones going to cook something up in the backyard and all that. Yeah. So.
Okay. So, Dr. Enyi, how has universal health coverage helped in reducing the mortality rate? Maternal mortality rates, to be specific. Yes.
Okay, so we'll say, like we said now, universal health coverage is talking about making sure that everybody has access to quality care. And for us here in Delta State, we want to specifically appreciate the governor, appreciate the commissioner for all they are doing in our health facilities. Our staff are skilled, top-notch. A lot of them go for a lot of training, so there's really nothing that they cannot handle per se, especially in our health facilities. And we have the different levels. We have the primary, we have the secondary, we have the tertiary. We have the primary that has been, well equipped. We have our staff that have been well trained. They have the facilities. So for the primary health care centers, there's also free maternal. So you have a lot of women that usually access this care. So when they go there, they see the skilled, and they also give them, there are some things they give them for just registering for antenatal. I think they give them mosquito nets, they give them different drugs and all that. So for Delta States, they are trying in that the facilities are available, the staff, they are available, there's free maternal, even for children under 5. So you can access quality care. You can access quality care, and you don't have to pay so much. And we are commending the government for this, because a lot of women have benefited. Yes. A lot of women have benefited. We even hear that people come from neighboring states, to come and access this free care that is available. So they are doing so much in terms of that to make sure that they are.
All right. Okay. So I'm very aware that the Honorable Commissioner in person for health, in person of Dr. Joseph Onojame has been doing a lot, and he has been very supportive, especially when it comes to primary health care.
Exactly.
But how well has MWAN done in sensitizing, people hearing their voice? Because whether we like it or not, everything has been put in place. The government might be doing so much, but there are still women, especially in rural areas, that are ignorant. So where does MWAN stand in all of this?
Okay. So thank you very much. So MWAN, that's Medical Women's Association of Nigeria, we are present in every state in the whole country. Okay. Our national president is Professor Rosemary Ogu. She's an obstetric and gynecologist, and she's very passionate about the cause of women and their children. And then our Delta State President, Dr. Oliver Gele. So for MWAN Delta State, what we usually do is almost every time, since we in Delta State, we have like 4 zones in different parts of the states. We first of all do a lot of advocacy, and just as part of what we are going to be doing for this universal health coverage, first of all we had a webinar, and then we are doing this TV sensitization. We're also going to have advocacy visits where we are going to meet key stakeholders to also bring forth, the issues that bother on women and children, and for the fact that since they are stakeholders, they are in place to change policies and make decisions that will favorably affect women and children. So this is what we are also doing. And then we also do a lot of media sensitization on the radio. We have jingles, We also have a well woman's clinic that we run in Warri. And so we have women that come in, we assess them, we screen them for so many things for free. Okay. They come in, and the Warri South Local Government Chairman is really supporting in this aspect. Every first Monday of the month, we go to the LGA. There's a health center there. The women come and offer their services free. The medical doctors, they come, they offer their services free. The women, they come, we attend to them. And we counsel them. So it's called like, you don't need to wait till you're dying. Just come in, receive counsel, do your screening, because as a woman, there are so many things you're supposed to be checking for. Your cervical cancer, we check your breast for breast cancer. Those are one of the top cancers that kill women. Yes. And we are all for women's health, even though we're also considering men too. But I mean, the women, let's see what we can do to make sure that
emphasis
we help
on
them.
Free.
Yes.
Okay, so very quickly, what are your last words to especially women out there who are still acting ignorant or some living in denial? What are your last words to them? So
we would like to say that Medical Women Delta States was speaking to our women that please, we have these facilities available. We're talking about universal health coverage. These facilities are available. Come and utilize them. And universal health coverage, health is our rights. Let's not sit down and then allow ourselves to die in ignorance. Let's come out, utilize these services. They are skilled people. Medical Women is behind you. Medical Women Nigeria, Medical Women Delta, DBS is behind you. They are giving us this platform to speak to us, to come out when don't wait till you're ill. Every woman should come and screen yourself, check yourself, how are you doing, and every man too. We're not discriminating, but come out, use the services that are available. Some of them are actually free. But we are hoping that at the end of it all, our illnesses will reduce. Health is our right. No woman should die because she's pregnant. And let's all support each other. You see a woman in the community, a lot of delays can happen. Let's see how we can put in ourselves to work together so that every woman, at the end of it all, has a positive pregnancy outcome.
Thank you so much,
Thank
Dr.
you so
Enyi.
much, Dr.
Thank you very much.
Thank you.
All right, for me, I would say that health is our right, as she said. It's better to go to the hospital panicking and then the doctor tells you nothing is wrong with you than to stay at home and die. Thank you so much, Dr. Enyi.
Thank you very much.
We truly appreciate how you've broken down every of this topic for us. Thank you very much. All right, we'll be speaking with Dr. Idotenyin Enyi, and she's the internal auditor, Medical Women's Association of Nigeria, MWAN Delta State Branch, and we've been talking on the topic universal health coverage and maternal health. Thank you so much. We appreciate you.
Thank you.
All right, don't go anywhere. When we come back, it will be time to talk trending issues and paper reviews. Mr. Boni Akeze, our paper analyst, is very much in the studio with us. Good morning.